Hello everyone, welcome to attend the TCM Plus Culture program held by Jiangxi University of Chinese Medicine, and this project is sponsored by the State Administration of Chinese Medicine. This is Dr. Zhou Ping Shen from Jiangxi University of Chinese Medicine, and I will introduce you the summary of TCM basic theory. My introduction includes 5 aspects. The first one is the theory system of TCM, and the second one is the basic characteristics of TCM. The third aspect is the yin-yang theory, and the fourth aspect is the 5 elements theory. The fifth aspect is the vascular manifestation, and I will present to you the first 4 aspects through the recording video, and the fifth aspect I will have online teaching together with you. So today we are going to talk about the first aspect, the theory system of TCM. First of all, let's take a look at these pictures. I have a question for you. So, what is the common signs of these 4 pictures? And what is the different features of these 4 pictures? Of course, I will tell you the background of these 4 pictures, okay? These four town manifestation was collected in March of 2020, and from the COVID-19 cases. So, according to modern science, we do understand that the COVID-19 was caused by the coronavirus. So, according to modern medicine, the etiology, the cause of disease, is quite clear, and quite simple, right? We say that is the coronavirus. But since it is caused by the same virus, why, from this town manifestation, why there are differences? So let's come back to our question. The common characteristics of these 4 towns. Actually, we can observe our own town. We can make a comparison. We can find that our own town is clean, and when we look at our own town or the town of the healthy people, we can get a pressure sense. But when we look at these 4 towns, the feeling is unpleasant. Is that right? Because we found that, on the surface of this 4 towns, there is a layer of greasy materials which covered on the town surface. Is that right? But on the healthy people, the town is clean. It's not so greasy. So this is the common signs. The common signs of these 4 towns. There is a greasy layer, a thick layer of greasy materials covered on the town surface. This is one. A second question is that, what's the difference feature of these 4 towns? Actually, we can find it very easily. the first two towns, okay, the color is light and white. I mean, the materials which covered on the town surface is white. The third and the fourth one, the color is deep. And the materials which covered on the town surface is yellow. Okay? So we found, okay, the common signs. We also found the different features of these towns. But these are, according to modern medicine, these are from the same disease, COVID-19. Okay? So, why there are differences? Why there are differences? And what is these differences? So, after we learn about the Chinese medicine, we will know about it. And we will understand how to treat, how to, provide therapeutic methods, okay, for such kind of disease. Okay, so let's come to the simply attribute of Chinese medicine. So you may ask, okay, what subject it is? Of course, there are a lot of saying, okay, like some people used to say that the Chinese medicine is a kind of accumulation of experiences. Of course, that's true. There's no doubt, okay, it's a kind of accumulation of experiences. But this subject is a science, okay, which research the birth, the development, and the disease of the human being. So, according to the science attribution, okay, it is the natural science. As well, this subject is also, research about the social, in the pathogenic factors, in the cause of the diseases, according to Chinese medicine, there are also social factors. Such as nowadays, we know, we understand very well, or we have a lot of, depression, we have a lot of emotion disease problems. And this emotion, this depression diseases, okay, are quite close with the social environment. So our living state, our living environment, our social environment always affect our health. So that is kind of, social problem. So this subject is also a social science. Okay, it's also a social science. And each subject, of course, it has a methodology foundation, a methodology suppose. So the Chinese medicine, okay, is guided by the Chinese ancient philosophy, such as yin, yang, 5 elements theory. So we say that the Chinese medicine is a kind of, subject attributed to the Chinese ancient philosophy. Okay, and also, as I mentioned, the modern science, okay, the modern medicine has only around 500 years history, but the Chinese people, okay, China, okay, we have more than 4,000-5,000 years history. So before the modern medicine, okay, the Chinese medicine, okay, is always protected the health and treating the disease for the Chinese people. So among the developing of the Chinese medicine, okay, and this medicine is quite influenced by the Chinese traditional culture. Okay, so we used to talk about the Chinese medicine together with the Chinese culture also. So this subject, okay, have 4 dissembling attributes: natural science, social science, Chinese ancient philosophy, and the Chinese traditional culture. Okay, next, okay, let's take a look at the theory system of Chinese medicine. Just now I had mentioned about, okay, each nation has their own traditional medicine, but Chinese traditional medicine, okay, is one of the, completed medicine, okay, which lasted for so long time, okay. So why? Because this subject has its own theory system together with the response theory, with the diagnostic methods, and with the therapeutic, okay, the treatment materials, okay, such as the formula and herbs and acupuncture. Okay, so let's take a look at this slide. Okay, here, this is the the system of this subject, and first of all, okay, we have the philosophical thinking. Okay, that is a guidance theory, as we mentioned just now. Okay, including the essence Qi, yin yang, and the 5 elements as the guidance theory. Okay, this is the methodology foundation. Okay, and under such kind of methodology foundation, okay, Chinese medicine holds the holism theory as the guidance. Okay, in the later class, okay, I will specific to you about the holism theory. Okay, and Chinese medicine hold the Zangfu essence, qi, blood, body fluids as the material foundation. Okay, so also in treatment, okay, the Chinese medicine that has its feature, that is the treatment based upon the syndrome differentiation. So what is that? For example, just now we had mentioned about the COVID-19. Okay, COVID-19, according to modern science, okay, we understand, okay, that is a kind of, coronavirus. So in treatment, what do we do? Okay, we take the coronavirus as the target, and we use drugs, use medicine to kill the virus, so as to, to reach the treatment purpose. But in Chinese medicine, okay, as we know, or in ancient times, okay, we don't have the microscope. Okay, we could not, visual the virus, the bacteria, okay, by our eyes. So, but we understand the disease, okay, through another points. Okay, that is syndrome. Okay, so we take syndrome as the therapeutic target. Okay, so that's why we say that, okay, the treatment is based upon the syndrome differentiation. Okay, but not like the virus differentiation or bacterial differentiation. Okay, so this is the general introduction of the theory system of Chinese medicine. Okay, let's come to the second part, the basic characteristics of TCM. So we had mentioned before, okay, there are 2 characteristics of TCM. The first one is the holism. So, as we mentioned before, the TCM is a natural science as well as a social science. So, the holism including two aspects. The first one is that the human being, the human body itself is an organic whole. Between the vessel organs and the orifice and the body structure tissues, this formed a very fine organic whole. And the second is that the human with the nature, we call it the nature environment and the social environment, is a whole. So the health condition, the disease occurrence, development, all affected by the natural, because the human being, is a part of the universe. And the second characteristic is that the treatment based upon syndrome differentiation. This means that in Chinese medicine, we cure the syndrome. By treating the syndrome, to cure the disease. So what is syndrome? And what is syndrome differentiation? In this part, we will learn. So first, let's look at the holism. The holism, you can see here, the contents is that, is the unity with the body. Especially, we'll talk about the holism of the body. So you can see, usually we understand through three aspects, through structure, through the physiology, through the pathology. In structure, it means that, the components, parts of the body are, close related. They are inseparable from each other. And in physiology, it means that all components, parts are related and subsidiary and conditionally to each other. So, like for example, each organ, each vessel, the physiological function, will manifest it outside. Will manifest it on the surface of our body. And the third aspect is that in pathology, it means that if there is any disease, occurred, among the vessel organs, it will manifest it outside also. So just now we had talked about the COVID-19. I show you those four pictures. So we have seen that the town coating of the four pictures is different with the normal person. That is a kind of pathogenical manifestation, right? So in structure, we say that the human body is centralized by the 5 zang organs. That is the liver, heart, spleen, lung, and the kidney. But these 5 zang, they are close connected with other part of the body. It's the center of the body. But it's connected with all other part of our body by the meridian and the cartilages, by the tissues. For example, the liver, is corresponding with the gallbladder. As well, in constituents, is connected with the tendons, and in orifice, is manifested on our eyes. So for example, in jaundice, jaundice, okay, is the liver system disease. So usually, okay, we can observe, okay, problem, okay, liver and the gallbladder, and we also can see the yellow eyes, right? And same as other vascular organs. Okay, so heart corresponding with small intestine, okay, and in 5 constituents, okay, connected with vessels, and tongue. The tongue is the window of the heart, and spleen, okay, corresponding with the stomach, and in 5 constituents, okay, connected with muscles and open at the mouth, and also the lung, okay, corresponding with large intestine, okay, and in 5 constituents corresponding with skin and open at the nose. So in COVID-19, okay, in COVID-19, just now we had talked about COVID-19. COVID-19 actually is a kind of lung disease, but in Chinese medicine, okay, we use the purgation methods. Purgation, the toxicity of the virus, okay, through the large intestine, so as to cure the COVID-19 disease, okay, and in kidney also, okay, kidney corresponding with the urinary bladder, okay, in 5 constituents, okay, corresponding with the bones and open at ear. So a lot of ear problem, okay, like deafness, okay, is close related with the function of the kidney. Okay, so that's why, okay, we say that, okay, the body, okay, the different part of the body, okay, is an organic whole. Okay, it's an organic whole. Okay, so we take a look at this picture. This is the take a look at this slide. Okay, this is the picture which show the the holism of the whole body. Okay, so next, what's the use of the holism? Just now, okay, we had mentioned holism actually is a guidance. Okay, it's a guidance of one of the guidance theory of the Chinese medicine. So what are you use of the holism? So we can, understand the pathology of the body, right? Through the, the manifestation, the out of our body, okay, to understand, okay, the pathologic change of the organs, okay, the vessel organs. Because the disease can transmit from the vessel organs to other structure. Like, for example, okay, the liver disease, okay, we can observe, just now we have mentioned, we can observe the eyes, right? As well, we also can observe the nails and the tendons to understand the liver disease, okay? And since we can understand, okay, the pathologic change, okay, through the guidance of the holism, so we can also guide the diagnosis by using the holism system, okay? So in the first part, we have talked about the town manifestation of the COVID-19. So how to understand that the COVID-19 by observing the town manifestation, because, okay, the town manifestation is close related with the change of the internal organs, okay? So that's why, okay, in Chinese medicine we have 4 diagnosis methods, which is the inspection, listening, and occultation, inquiry, and the pulse taking and palpitation. So especially, okay, the town diagnostic methods and the pulse diagnostic methods is two special diagnostic methods. Of course, in future, okay, we'll learn about the pulse diagnostic. So, but we can understand tongue. Okay, the tongue is a very small point of the body. But by observing the tongue manifestation, we can understand the nature of the disease and the pathogenic factors of the disease. Let's think about the picture, okay, which I showed you before. Do you remember that the COVID-19 cases, okay, they have a very thick, greasy materials on the tongue surface. So what is that? In Chinese medicine, okay, we think, okay, that is a kind of dampness, a kind of toxicity combined with dampness, okay, which formed a thick, greasy coating on the tongue surface. And the some, the same disease, right? Same disease, okay. All those four tongues, okay, they are the COVID-19 cases, but two of them have the white tongue coating and the two of them have the yellow tongue coating. So what is that? That is because the nature, okay, of the disease, okay, which occurs on this person are different. The white one, okay, is natured in cold, and the yellow one, okay, natured in heat, okay, in heat. Okay, so this is the holism, okay, used for guiding the diagnosis, okay, the guiding the diagnosis. And the second characteristics is the treatment based upon syndrome differentiation. So we had mentioned several times, okay, about the syndrome. So what is syndrome? Okay, so to understand the treatment based upon syndrome differentiation, first of all, we got to understand the conception of syndrome. Okay, so what is syndrome? Okay, but here to understand the syndrome, we need to understand the symptoms and the disease. Okay, the disease. Symptoms, actually that is very easy, okay, for us to understand, okay, because all of us, okay, may have health problem, okay, before, so which manifested a series of symptoms. Okay, so symptoms refers to the clinical manifestation of disease, including the uncomfortable feeling of the patient and the result detected by doctors. So what is that? The uncomfortable feeling. Okay, for example, headache, nausea, vomiting, cough. Okay, this is a kind of sign of disease, right? And the sign detected by the doctors, like the tongue coating, the pulse feeling, the blood pressure, okay, all this will be corrected by the doctors. So this is also a type or a kind of symptom. All right? So, in clinic, after we collect this kind of symptoms, do we know how to provide treatment for the disease? Of course not. For example, headache. Headache is kind of symptoms, so it's kind of signs. So in so many diseases, okay, we can observe headache. How to provide the treatment methods? No, we can't, right? So we need analyze, okay, we need to combine all the symptoms together and analyze the symptoms to understand the pathogenic mechanism of the symptoms. So we need go to the next point. Okay, that is the syndrome. Okay, that is the syndrome. What is syndrome? Okay, take a look at the slide. Okay, the pathological generalization of disease on a given stage in the course of the development. What is that? A disease. Okay, disease is the long course, is the full course. So in different stage of the disease, the symptoms are different. Of course, the syndrome is a kind of generalization of the currently okay stage. Okay, so it includes location, cause, property, and the relationship of the pathogenic factors and the body resistance. It provides the essence of the pathogenic changes at a certain point of the disease development. So, conclusion. Okay, the syndrome. What is syndrome? Is a generalization of the certain stage of the disease, a current stage of the disease, and the syndrome has some elements. Okay, that is the must include the location, the property of the disease, the currently disease, okay, and the cause, and also during this period, okay, during this stage, the relationship between the pathogenic factors and the body immune system. Okay, later on, okay, we'll have examples. Okay, we'll have examples. We can take a look at this slide. Okay, we'll take the common cold. Okay, in Chinese we call it 感冒. Okay, as an example. So, common cold is the name of the disease. Okay, it's the name of disease. So, we all had experienced such kind of disease, common cold, right? So, during this disease, we may have, such kind of, take a look, this point, okay, we may have such kind of symptoms, like, for example, fever, okay, sometimes, okay, we aversion to cold, and sometimes we aversion to wind. Sometimes we have no sweat, sometimes, okay, we have profuse sweat, okay, or we have headache, okay, we have, thin and white tongue coating. Okay, here white coating. Okay, but in some common cold, okay, we can observe thin and yellow tongue coating. And for the pulse also, in some cases, okay, we can observe the tight pulse, and some cases, okay, we can observe the fast pulse. What is that? Why? Sometimes, okay, there's no sweat. Sometimes, okay, there's sweating. Why? Okay, some cases we can observe the white tongue coating, and in some cases we can observe the yellow tongue coating. Why? In some cases, okay, we can observe the tight pulse, and in some cases we can get the fast pulse. Because, okay, even the disease is the same, okay, but the syndrome is different because the symptoms are different. Okay, so we analyze, okay, this group of symptoms. We make conclusion that this is a sign of what? Sign of cold. And this sweat, yellow, fast, is a sign of what? A sign of heat. Okay, a sign of heat. So, this stage is the wind cold exterior stage, wind cold exterior syndrome. And in this stage is the wind heat exterior syndrome. So that is the difference of the syndrome. So by understand the difference of the syndrome in treatment, okay, in treatment, of course, you know, we had made the syndrome differentiation, okay, both are the location, okay, of both syndrome, okay, is the exterior, that is the superficial, okay, cause, okay, one is wind cold and the other one is wind heat, okay, and the properties, of course, both are excesses. So during this period, okay, is the pathogenic excesses, okay, the health Qi is not deficiency. So in treatment, what do we do? Okay, the therapeutic principle, we need relieve the exterior syndrome with the pungent, okay, warm or cool herbs. So for the wind cold, we choose the pungent and warm herbs. And for the wind heat, can we choose the pungent warm herbs again? Of course not. Okay, we must choose the pungent cool herbs. Okay, so that's why we have, you know, the treatment of same disease. Just now we are talking about the common cold, right? It's same disease but with different methods. Okay, with different methods. We also sometimes, okay, we treat the different disease with the same methods. Why? Because the syndrome are same. We can take a look at the example. We can take a look at the example. Okay, we can come back again. Okay, come back again. Okay, to the common cold, right? Just now we had analyzed, okay, the two syndrome. One is the wind cold exterior syndrome, and the other one is the wind warm exterior syndrome. For the wind cold exterior syndrome, we use the pungent and the warm herbs. So we choose this ma huang tang. Okay, and for the wind warm exterior syndrome, we choose the pungent and the cool herbs. We use yin qiao san. Okay, we use yin qiao san. Okay, and treat the different disease with the same methods. We can take a look at this example. We say that, okay, like for example, this prolapse of rectum, prolapse of uterus, and the chronic dysentery. So, of course, these three are three different diseases, but the mechanism, the causes, they are same. It's because it's due to the sinking of the we call that the middle qi. Okay, the middle qi. So in syndrome is a kind of, you know, syndrome of sinking middle qi. So we can use the same methods. We just need to nourish and elevating the middle qi, so we can, you know, cure the different disease with the same methods. Okay, so this is the two characteristics of TCM.